Welcome to the Tech Blog Writer Podcast, your guide to future tech trends and innovation in a language you understand. Now, over to your host, Neil Hughes.
Welcome back to the Tech Blog Writer Podcast. We're at that time of the year where most people leave the house to go to work in the morning and it's dark, only for them to return from the office in the evening and it's still dark. A lack of vitamin D and the flu season might mean that you're feeling a little sorry for yourself, but not on my watch, listeners. Change the world with your smile, but don't let the world change your smile, I say. So one subject that I think will affect every single one of us in our life is healthcare. And I'm noticing that there's a real shift from being reactive and waiting for something to go wrong and a proactive approach to healthcare now. I mean, after all, prevention is better than any cure, but many still avoid those regular checkups and screenings. But I recently came across a company called NovuHealth, and they're a company trying to change all that by using the same tactics that keep people coming back into Starbucks, Target and Hilton, etc., but actually using those tactics to get people in to see their doctor. I think it's a unique angle on its own, but when I also delved a little deeper, I quickly discovered that it's based in Minneapolis, which is increasingly appearing on my radar for being a hotbed for HealthTech startups. So it's time for us to find out more, because I'm going to beam your ears all the way to Minneapolis so we can speak with Jordan from NovuHealth. So a massive welcome to the show. Can you tell the listeners a little about who you are and what you do?
Sure, Neil. My name is Jordan Maurer. I'm the Executive Vice President of Marketing Engagement at NovuHealth. My background is 25 years in consumer industries, activating consumers to drive high-value activities to create revenue and cost takeout for businesses, everything from hospitality to airlines to financial services, for-profit, online, higher education, consumer products, etc. And the last 4+ years I've spent in healthcare, working to bring concepts of direct marketing and loyalty marketing to the healthcare equation. It's a space that healthcare in the U.S. Has been sort of behind other industries in its drive to consumerism, and activating consumers in things that are both good for the healthcare ecosystem as well as for their own health is what NovuHealth does, and my experience and background brings that to bear.
I was just going to say that. It sounds like you've been in a lot of different industries that are very different to healthcare. Do you think everything that you learned in that former life has made you think, how can I actually bring this into healthcare?
It has. It's been really interesting for those 4+ years is applying the right strategies. Not all strategies will move to the healthcare space smoothly, but applying the right strategies. It's an industry that really can benefit and has benefited from the work that we're doing to engage and activate consumers. And a lot of the principles that do apply in other industries do apply here, although they have to be twisted or flipped to appropriately work in the healthcare context. Obviously, privacy and the healthcare barriers to engaging consumers are different. So thinking about those things, but the applications really do work and the strategies really do work. So it's been fantastic to be bringing that kind of expertise to healthcare.
So for anyone listening to us now that are hearing about NovuHealth for the very first time, can you just help them visualize exactly what it is and what problems you solve with NovuHealth?
Yeah, absolutely. So NovuHealth is a technology and services company, and our background and what we do in the healthcare space is we drive consumer engagement. We do that through consumer marketing, through performance analytics, which is really understanding who are the right healthcare members, patients to move, and how through behavioral sciences can we effectively motivate and activate those consumers to both engage in their own health and create value for healthcare companies, specifically in the payer space. Our programs operate on that technology platform, much like marketing automation happens in many other industries, except for in healthcare, we're both digital and offline. So our consumer experiences would allow for an omni-channel sort of access and integration with the consumer experience in a way that we could touch them through a live agent call, through direct mail, through in-home care management, through digital experiences like online web, email, SMS technologies, automated IVR, et cetera. So when we kind of operate beyond what people experience in just digital-only platforms, because the markets that we serve, Medicare and Medicaid, require that we operate, and in fact, because the consumer still needs for us to operate offline in many ways. So direct mail is a big part of our, for example, our senior experience in Medicare Advantage, as an example.
Now, what really caught my eye about you guys was I read that NovuHealth is using the same tactics that keep people coming back to Starbucks, Target and Hilton, but actually to get people to the doctor, and as a result revolutionise member engagement in a new era of care. I think it's a fantastic angle and really unique. I mean, can you expand on that a little bit?
Absolutely. So you're talking about engagement in healthcare and how it sort of leverages the retail loyalty or engagement models that many industries use. And you referenced Delta Airlines Sky Miles program, or the Starbucks Rewards program, or even the retail experiences we see at retailers like Target and Amazon. It's all about, first and foremost, creating a value proposition that's meaningful to the consumer. And in healthcare, it's about keeping it simple. It's about very, very, very personalized experiences in information and the ask of the member or patient as to what it is that you want them to be engaged in. But the experience feels, very similar to a traditional loyalty program, where the ask from the health plan to its member or patient or consumer is, we have some preventive care, for example, that we want you to get because you're diabetic. So I want to make sure you're getting your A1C and your diabetic eye exams as an example. And in return for those screening events or those preventive care events, the health plans offer rewards and incentives, traditionally through gift cards. It's a very usable, easy consumer experience. So the ask might be something like, go get a diabetic eye screening, and you'll receive a $50 offering to Target, Best Buy, Amazon, as an example, from a gift card perspective. So it's a give-get relationship that the consumer really understands. We use, gift cards are a motivating factor to activate members in their own health. But it has to be tied in with relevant, personalized communications that are meaningful to the member, in addition to incentives that sort of drive the action.
Now, you mentioned incentives there. Can you also tell me more about your performance analytics, behaviour science, and the comprehensive technology solutions there that you're introducing, and also the benefits that brings?
Yeah, absolutely. So in thinking about any member population, especially from a health plan perspective, today's health plans are held accountable for quality and performance beyond, the cost models that they used to be involved with. So in many markets like Medicare Advantage, in Medicaid, in qualified health plan arenas under the Affordable Care Act, we find that health plans are held accountable to engage the consumer in quality improvement initiatives and efforts like HEDIS and STAR and pay-per-performance programs in Medicaid. And in doing so, we use performance analytics to help health plans identify, segment, and target the right members with the right incentives and the right offers to drive incremental business performance. And I'll give you a more granular kind of example of that. So health plans, are held accountable for numerator-denominator equations, much like you and I experienced when we were going through higher education. To get an A in class, you had to get a 90% on the rubric. Well, that's the same thing for health plans. They have to get a certain number of members to complete these preventive healthcare screenings, for example, for quality performance. And by identifying the members that with an outreach and with an incentive are likely to activate and close that healthcare gap, performance analytics really helps identify who those members are, their likelihood to activate, and it provides the health plan with a more efficient and effective program. So we link their, consumer data information from the health plan on eligibility, who is that member, and what is their, particular disease or health condition, and we link that with third-party consumer data, and the combination of those two things with our outcomes history on other like populations gives us the ability to really hone in and get at driving unique value or segmented targeted value out of specific groups of consumers. So it's all about creating business value, because marketing, as we all know, is a discipline of communications and response. And the better that you can communicate the right message to the right person and drive the maximum response rate, the more effective and efficient your marketing and communications expenditures will be.
So now that we're actually looking at these different ways of working and also the advances of technology, do you think we're actually heading for a more proactive rather than reactive approach to healthcare as a whole? Especially by catching things like cancer and diabetes much sooner rather than waiting until you've got it and then treating it?
Well, there certainly is a broad array of evidence in the healthcare space that an engaged consumer, an engaged healthcare consumer, is better at managing their health condition and obviously costs the healthcare industry and health itself is less expensive over time. I'll reference a KPMG study as well as FAIR's study from 2016 that was done through Fairview that also indicates that there's a significant cost reduction in engaging consumers in their health. In fact, almost a 50% reduction is seen in medical costs over time from an engaged consumer. So the idea and the use of incentives to activate engaged consumers is an important strategy for health plans, and certainly coupled with other, good experiences through primary care and the clinician environment, as well as support from a health plan overall. I do think that members are starting to see that their health can be improved through preventive care.
Well, NovuHealth's got to be doing something right, because I think I read recently that it's one of the top 5 fastest growing companies in the whole of Minneapolis. I mean, that's got to give you a good indication that you're on the right track here, isn't it?
We're thrilled to have been recognized in Minneapolis as part of the Fast 50. A startup we're past startup now. We're a company that's been operating for 6 years now, and we're up to almost 160 employees and significant revenue growth. So the success has been driven really by the performance that we drive out of our engagement programs with health plans. I would say it's luck, but we've got a lot of experience in bringing consumer value propositions to healthcare, and the effectivity of our programs has been a result of both the technology as well as the integration of marketing in that omni-channel perspective, the ability to personalize communications down to the member level and drive specific incentives for specific high-value actions or activities we're asking members to do for health plans and their own health. The combination of that has, recognized us in both providing the evidence of our success, but, really the ability to talk with some expertise in the space and show our capabilities. So that recognition is, kind of coming full circle, very nicely received.
Now, I've also read recently that I think Minnesota is poised to become a hotbed for digital health startups. I mean, is that something you're aware of? And if so, why do you think it is?
Well, my perspective is that there's so much innovation going on in the digital health space, and I think looking at some studies here that there's almost $1 billion going on in digital health experiences. $500 million in big data and analytics, 7,600 startups trying to attack the problem, just last year. And I think the key to it is that you have to understand healthcare from the inside out. Consumer companies, Apple, Google, others, many have tried to approach the space, but without having a really solid understanding of what the healthcare challenges are, the regulations and how they're so different and unique in the healthcare arena, that Minnesota is a healthcare hub. The health technology, medical capital perspective, you certainly see it in med device, in the leading research institutions that we have here in the Twin Cities and Rochester, Mayo, from a clinical perspective, United Healthcare, very sizable healthcare entities with large pools of expertise. And when you think about Minneapolis, that it is a cornerstone of healthcare. It's also a cornerstone of consumer marketing. Companies like Target and Best Buy the agency world here in Minneapolis is strong. So it's the bringing together of the expertise of consumer marketing and healthcare that really is going to be what's needed to drive engagement. And that's why I think Minneapolis is well suited to be a hotbed for digital innovation or healthcare innovation in general, and to move to consumerism, because those expertise live here. The richness of the human capital that's necessary for any startup to be successful, the ingredients is here in Minneapolis.
So what's your grand vision for NovuHealth, and indeed the future of healthcare as well? How do you see that?
Well, I mean, certainly our role in healthcare is to activate and engage the consumer, both for the betterment of their own health as well as the improvement of the healthcare ecosystem. And we've been doing that and will continue to do that with healthcare payers in the U.S. And eventually the equation of the consumer model is going to transcend to the provider arena as well. And Novu will be there to support those two key parties in the engagement of the consumer, and really putting the consumer at the middle of the equation between their health insurance company and their provider. And we see that there's really no change in that direction. The consumer expectation around healthcare, the digitization and consumerization of the experience just requires that the healthcare system in general adopts consumer-based strategies, and that's what Novu is known to, and what we deliver against.
Well, a huge thanks for coming on the show today. Before I let you go, though, can you remind the listeners of where they can find you on the web, and also how they can contact a member of your team if they have any further questions about anything that we've spoken about today?
Absolutely. So we're at novu.com, novu.com. And all of our contact information is there, but you can certainly reach us via email at info@novu.com. And my name is Jordan, Jordan, last name Mauer, also at novu.com. So feel free to reach out to me directly.
Well, one of the reasons I love doing this show is hearing about these new startup communities, not only in the US, but all over the world or anywhere outside of Silicon Valley. But to hear that Minnesota is now a hotbed for digital health startups and NovuHealth is right at the heart of it all is a real value add for me. So a big thank you for coming on and sharing that story today.
Fantastic, Neil, and let me know if I can ever be a resource for you in the healthcare space as you continue your efforts to promote great companies doing great things.
The fact that thousands of people every year skip those necessary health screenings because it's inconvenient, they're busy, or they simply don't want to go is a huge concern. Especially considering that I think it's only 25% of adults aged 50 to 64 and less than 40% of adults aged 65 and upwards are actually up to date on those core preventative services, such as mammograms, cancer and diabetes screenings. But surprisingly, a $15 gift card is all it can take to get 80 to 90% of people to actually go out and make that appointment. And it'll even get 50% of people to get a colon cancer screening. So I am fascinated at how NovuHealth are actually using a combination of marketing and technology to prove that not only do rewards work, but they can actually save lives. The benefits, in addition to actually saving lives by catching cancer and diabetes sooner, is that it's a lot cheaper and people are actually happier because they're not sick. I think it's a great health tech example and something I'll be watching very closely with how the world of health tech evolves. If you have any stories or insights about how tech is revolutionising your industry, or just have a question to ask, remember to email me at techblogwriter@outlook.com or tweet me at Neil C. Hughes. But I'm afraid it's time for me to walk away from the mic now. So as always, a big thank you for listening, and until next time, don't be a stranger.
Thanks for listening to the Tech Blog Writer Podcast. Until next time, remember, technology is best when it brings people together.